Hi, everyone, and welcome back to the Sex Advent Calendar, 25 days of sex education all through the month of December. Today, I wanted to talk about an issue that has affected a lot of people with vulvas and vaginas, and that is unexplained pelvic pain. Unfortunately, our medical community is a little bit fragmented in how we address pelvic pain, and a lot of providers haven't had a whole lot of experience dealing with some of these issues. So I wanted to provide a primer on helping you identify what road you might need to pursue to figure out what's going on with your body and help you get back to a place where you feel comfortable and happy. So pelvic pain can be either physiological or psychological in nature. And the usual way that I distinguish between the two is that something that has a physical cause is often a slow onset. So symptoms will sort of creep up on you and it'll increase over time, versus something that is more psychological or trauma-based perhaps is often very abrupt. So you'll notice symptoms of pain or shock very suddenly, and it seems like it came out of nowhere. So when we're talking about psychological causes of pelvic pain, this can come from a lot of different places, but one of the big ones is shame. So our culture is incredibly sex negative, and we have received a lot of messages throughout our lives about what we are supposed to do around sex and what we are supposed to want. So a lot of people have baggage around whether or not masturbation is okay, whether sex is okay outside of a committed relationship or marriage, whether they're even allowed to experience pleasure at all. And certainly there's a lot of shame around what our bodies look like and how we physically inhabit space as sexual beings. The other element of psychological problems can come down to trauma. So we know that we live in a world where sexual abuse, assault, or just generally unpleasant experiences, even if we don't label them specifically as traumatic, happen all the time. And those can have profound impacts on how we live in our bodies and how we experience our sexuality. So when pain shows up sort of out of the blue, there's often a trigger back in our histories that has come to the surface for some reason and maybe tied to some very long-standing beliefs or a difficult experience we've had in the past. The physiological side of things can go a whole lot of different directions. So if you've experienced some slow onset symptoms of pelvic pain, it may be from something like pudendal nerve damage, which is one of the major nerves that runs through our genital areas, and that can become compressed between your discs, and that can cause us to interpret pleasurable things or neutral experiences as painful. We also can have a lot of problems with our pelvic floor, and that can either be from it being chronically tight or from it being those muscles being very weak. And I definitely encourage you to take a look at Roxy Delladonna's interview that I did earlier in the week, where she talks more specifically about pelvic floor issues. So one of the pelvic pain diagnoses that is sort of coming to the forefront more now is endometriosis. And that is essentially a disorder where the uterine lining actually moves out into other areas of the body. So when that tissue migrates out of the uterus and then grows in other areas of the abdomen and the pelvis, it can cause a lot of pain because it is essentially creating an inflammation response. Your body says, what is this tissue doing here? And so there is pain from the body naturally trying to respond to this invasive tissue. Other things that can be going on may have nothing to do with your reproductive system. You could be experiencing irritable bowel syndrome where you're having trouble with your colon, hopefully not appendicitis where there's inflammation of your appendix, a UTI, or any number of other issues that have to do more with your urinary tract or your lymphatic system. If you're experiencing pain only for a day or so right in the middle of your cycle, what may be happening is actually Mittelschmerz, which is just pain during ovulation. During part of your cycle, a developing egg will burst out of the ovary so that it can travel down the fallopian tube to become fertilized. When that happens, some people will experience a very painful sensation, usually on only one side of their body, and that is the rupturing of the follicle where the egg escapes. So One of the more serious things that could be going on, of course, is ectopic pregnancy. So ectopic pregnancies happen when a fertilized egg attaches somewhere other than in the lining of the uterus. The fertilized egg often attaches inside or on the fallopian tubes, which cannot support the weight of a developing embryo. So that becomes a very serious health issue very quickly, because it can cause the tubes to twist or to break and to cause sepsis in your pelvic region. So you want to get that taken care of by a medical provider as soon as possible. Of course, there's also the possibility that you could have ovarian cysts or uterine fibroids or another foreign body in your uterus. Those are usually diagnosed with an ultrasound, which you can get a referral to from your gynecologist. So there are a lot of different things going on that could be causing pelvic pain, and that means that there are also a wide variety of professionals that could help you in diagnosing and treating these issues. Obviously, if you feel like there's any kind of psychological issues going on around shame or trauma, your first stop should be a therapist. Sex therapists and marriage and family therapy counselors and trauma therapists often have specific training in how to address sexual assault and other difficulties associated with sex and intimacy, but any therapist should be able to help you start the process of uncovering what it is that is hurting you emotionally and psychologically. For people who experience post-traumatic stress disorder, or PTSD, EMDR is a particular form of therapy that can be helpful in processing emotionally traumatic experiences and helping reduce the amount of emotional response that we have to those memories. Your primary care doctor is an important member of your care team, regardless of whether the issue you're facing is psychological or physical. So primary care doctors can run blood tests for STIs, treat urinary tract infections, and provide referrals to specialists, whether those are therapists, pelvic floor specialists, or gynecologists. A gynecologist is particularly useful for dealing with structural issues like fibroids or an ectopic pregnancy, both of which get diagnosed with an ultrasound. They can also prescribe steroid creams, which are useful for generalized external pain in your vulva. So if you can't figure out what is causing you to experience pain, sometimes a steroid cream can help with that. Pelvic floor therapists are a kind of specialists that do biofeedback and physical therapy exercises that retrain the muscles in your pelvis. So if you're experiencing pain that is related to those muscles, a pelvic floor therapist can be really helpful. And lastly, there are sexual health specialists who are a good addendum if your current provider network can't identify or can't treat a more complex problem. The most important thing that I want you to take away from this video, though, is that you're not imagining your symptoms. So don't let your providers dismiss you or say something rude like, oh, you just need to have a glass of wine and you'll loosen up and it'll be fine. Or you just have to grit and bear it and deal with this pain and difficulty that you're experiencing. You deserve support, you deserve treatment, you deserve to be having a fulfilling and satisfying experience sexually and just in your daily life. If you're experiencing pain, that is not you living your fullest life, and you deserve to be at optimal functioning, not just surviving. So I hope that this has given you some suggestions on how you can reach out to your provider network and really find the support that you need to move forward. Stay tuned for more videos all through December. And as always, if you'd like to support my work and the sex education I'm providing to the community, please go on over to store.intimatehealthconsulting.com and see about purchasing a coaching package or making a donation so that I can continue to provide good quality sex education. Thank you so much and have a great day.